skin cancer is not the first thing that comes to mind. But according to the American Academy of Dermatology, on their 2015 website, more than 8,500 people in the United States are diagnosed with skin cancer every day. Skin cancer is one of the most common types of cancer and also one of the most preventable. After researching skin cancer and having a close relationship with a few people who have been diagnosed with it, I feel as though I have the knowledge to inform you on what skin cancer is and how it can be prevented. Today I will be discussing what skin cancer is, the different types, the different symptoms, and treatment and prevention methods. First, I will discuss what skin cancer is. Skin cancer is an abnormal growth of skin cells caused by damage to the DNA. The damaged DNA causes mutations that make skin cells multiply rapidly and eventually form malignant tumors. While all types of skin cancer are generally the same, there are slight differences from type to type. The three main types of skin cancer include basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most common type of skin cancer. According to the American Academy of Dermatology, 8 out of every skin cancer cases are basal cell carcinomas. This type of skin cancer is most commonly found on areas of the body that are frequently exposed to the sun, such as the face, neck, and shoulder areas of the body. It develops on the basal layer of the skin, which is the inner part of the epidermis. Oftentimes, after the basal cell carcinomas are treated, they will reoccur in the same areas of the body. Squamous cell carcinoma is the second most common form of skin cancer. This form of skin cancer is found on the outer layer of the skin. While it is most commonly found on the face and neck regions, it can also be found in scars, cuts, and fatty tissues of the body. Melanoma is a less common form of skin cancer, but is the most dangerous out of them all. Melanoma develops in melanocytes, which are the cells in your body that give your hair, eyes, and skin pigmentation. It can also form in your internal organs, but that is less common. Even though the types of skin cancers are generally the same, there are some differences in symptoms from type to type. Each type of skin cancer generally has some sort of visual symptom on the outside of the body. While they vary from type to type and look to look, some of them are hard to tell the difference without going to the doctor. A good way to check your spots on their skin are by using the ABCs of skin cancer. Check for asymmetry, border irregularity, color, diameter, and evolution. Basal cell carcinoma symptoms are mainly all external and look like some sort of patch on the skin. According to the Mayo Clinic staff website, basal cell carcinomas can come in many different shapes and sizes, but they are typically pink, brown, or black. The early symptom of this type of cancer is a pearly-looking bump that many people will compare to a wart or small scar. Another way to tell the difference between basal cell carcinoma and other forms of skin cancer is that basal cell spots tend to bleed easily. Squamous cell carcinoma has many of the same symptoms as basal cell, but there are some differences. According to Mayo Clinic, other symptoms of squamous cell carcinoma include a hard red bump rather than a pearly-looking one. And oftentimes they won't just appear, but they will grow within a spot that you already have on your skin, such as a scar, birthmark, or mole. As stated by Mary Ellen Siegel in her book, The Cancer Patient's Handbook, melanoma can oftentimes be harder to detect because it is more likely to occur in hidden areas of your body. Many cases of melanoma start within the eye, under a nail, on the bottom of your feet, or even internally. The main symptom of melanoma in the eye is loss of vision or blurry vision. If it is on the outside of the skin, it will appear as some sort of patch that is changing in size, shape, and color. When melanoma is internally, there is not an easy way to detect it rather than going to the doctor and being scanned for any tumors on your organs. While knowing the symptoms of skin cancer is important, it is also important to know how to prevent and treat it. According to the Georgia Dermatology Center in their 2016 YouTube video, taking preventable measures could prevent more than 3 million cases of skin cancer each year. There are multiple ways to prevent skin cancer according to the Georgia Dermatology Center. The 3 easiest ways to prevent it is to wear sunscreen daily, apply it to your face, neck, and shoulder regions, and don't forget behind the ears because those are the most common areas for skin cancer. Avoid the sun's harmful UV rays, especially between 10 a.m. and 2 p.m. when they're at their most powerful or most intense, and schedule regular skin exams. While some skin cancers can be prevented, many cases will begin before you reach adulthood, and once the damage is done, there is no way to reverse it. If someone is diagnosed with skin cancer, there are many treatment options based on which form of skin cancer you have. According to Eugene Bain, John Carusi, and Elizabeth Hale in their 2016 Cancer Foundation Journal, the 4 main treatment options for skin cancer are removal of the spot or tumor, radiation therapy, chemotherapy, and topical lotions. For being one of the most preventable types of skin cancer is not prevented very often. Today I have shared with you what skin cancer is and the different types, different symptoms of skin cancer, and different treatment and prevention methods. Even with all the prevention options, skin cancer is still highly diagnosed. The American Academy of Dermatology stated 1 in 5 Americans will be diagnosed with skin cancer in their lifetime. Will you be the one, or are you going to take preventable measures to make sure that you live a happy and healthy life?